Welcome to the Relationships Inside Out podcast with Doctors Gregory Siebert and Kimberly Murray, licensed marriage and family therapists. Join them on this journey as they explore the ins and outs of relationships.
Well, welcome to Relationships Inside Out, where today we're going to talk about medication and mental health.
Medication gets such a bad rap. Here's my theory on it. People think of medication as things like Xanax, where it's highly addictive, numbs you out, completely changes your state of mental health. And that is but one class. It's a benzodiazepine, whereas there's lots of classes and lots of options of medications that can actually help quality of life for a lot of people.
Yeah, it very much can change people's lives, depending on where the need is at.
Absolutely.
But like you're talking about, there's stigma about medication in general. One is the dependence, which you're hitting on. A
Yeah.
lot of people fear that a lot of it is we're going to be addicted.
Yeah.
Which is not true.
Nope.
There are certain classes maybe, but there's a lot that are not. And we're not going to cover specific medications, but more about just kind of the conversation. Because there's a lot of clients that we work with that, that might be an
Absolutely.
option. And there's a lot of hesitation to go there and they might need it. And when you think about medication in particular, it doesn't mean that's another thing. If people believe it's like forever, there's a lot
Good point.
there's a lot of times it's really just to manage your symptoms, to get you to a baseline, to actually then work through therapy, which then once you kind of get some skills and you're learning how to manage stuff behaviorally or cognitively, then you might be able to titrate off the medication. It's not a forever thing for a lot of people.
Some people it might be. I'm one of them.
Mm-hmm.
I don't produce serotonin.
Yeah.
But I wouldn't have known that if I didn't get it checked, right?
Yeah.
So that's step one. And with medications, there's so many options that you don't have to feel numb. Everyone's afraid of feeling numb or weird, or you're not going to feel any enjoyment. If that's true, it's probably not the right medication anyway.
Change it up.
The goal of the medication is to feel like yourself,
Yeah.
not to be numb to your existence.
Well, I mean, sometimes I'm just kidding. Well, and that talks a little bit about another fear that people have is the side effects. Like for me, the
Yes.
one I hate the most that I'm always looking at if I'm going on a medication or not is weight gain.
Yep.
Like I just don't want it. I don't want it.
And that's okay.
And I don't like the numb feeling either. So, but there are some that don't, and you have to try it out. But side effects are a big one because like, what's the point? If I'm going to get rid of these, but I'm going to instead experience these, I think at the decision, I also don't think that
Absolutely.
side effects should deter you because there are some that have very minimal. And actually, I think a lot of medications, their side effects are pretty minimal when you think about it.
Oh, absolutely.
But that's when you think of side effects, you think about, oh, I could get that. At a probability is probably very, very low. So just learning about it, educating yourself in particular about those side effects or what other options there are. And of course, I mean, working with a professional to explore these is going to be
By professional, we don't mean PCP. I got to put that plug in here.
primary care provider.
We mean a psychiatrist.
Yeah, somebody-
You don't go
yeah.
to your primary care for heart issues. Please don't go for brain issues. If it is a mental health thing, it is brain chemistry. Go to someone who specializes in this. It could be a psychiatric nurse practitioner, a full psychiatrist. Whoever specializes in this is where we encourage to go.
Yeah. Because they know more about our field in relation
100%.
to how the medication works. And they're also educated on how that medication might impact other medication you're on for other things not related to
Yes.
mental health, which is very, very important.
The interaction side effects.
The interaction.
Mhm.
Another thing that is a problem with medication for people is there's a lot of stigma around mental health in general that if you need medication, it's considered a weakness. But
Or you must be crazy.
yeah, something must be wrong that you need medication. But you think about somebody with diabetes, no problem. I'll take medication most of the time.
Because physical health.
It's physical health. So we think
Yeah.
about the difference between physical and mental health. Mental health is a weakness, right? And you see that even culturally. Some cultures are like, no, mental health doesn't exist. Like that's not a thing. We don't talk about that.
You
like-
just choose to not be anxious. You choose to not be
Yeah.
depressed.
Willpower is a big way that they see.
Wish that were true.
Yeah. And maybe for them, that's fine. But for a lot of people, mental health and that stigma is a barrier because, I must be weak if I need medication. It's okay. Well, you can sit there and experience what you're experiencing because you don't want to be seen weak, or you can improve your quality of life potentially.
And secret, no one has to know you're taking it.
Yeah.
This belief that if I take this medication, everyone's going to know, they won't. All they're going to know is maybe you feel happier. Maybe you're less irritable. Maybe you're calmer. That's what they're going to know. They don't have to know
Yeah.
the how, right? That's the hope, is that you get to be your full self. If you need the support, take it.
And the people you're afraid of knowing probably are on medication too.
True.
I mean, all of us are. You and I are professionals in the field and we'll take medication.
Yeah.
So, but then again, we have work and experience to help destigmatize that for ourselves.
100%.
And that's what this conversation today is about, is what are the barriers and overcoming.
Navigate them.
Yeah. How do you navigate them and how do you overcome them? Because they are real barriers and we experience them a lot with
100%.
our clients. And there's just too many factors in the mental health through our history, right? I mean, you think about over-medication, lobotomies in the psychiatric world. Like there has not been a good history for mental health in our
We've done some weird things.
culture.
So for those who don't know, lobotomies, they used to take a probe essentially and go through your tear duct and then in all intents and purposes, scramble up a part of your brain.
Yeah.
And essentially it would make it so you were labile or didn't have any emotions at all. We don't do them anymore.
Yeah.
They were barbaric. They were not great. But this is
Yeah.
part of where we get this, or the Freudian stigma of laying on a couch and talking about your mother and then I'm going to numb you out with meds. That's
Yeah.
not what it is anymore. At
Yeah.
least hopefully not.
And the mistrust makes sense.
100%.
And to me, I hope the message is we need to start questioning these myths or perceptions we have. So medication or even that being an option isn't not considered, I guess, to improve our quality of life, if you will. I mean,
And I see that stigma come from all kinds of avenues. So it could be culturally or social media or marketing. It could be our family or our faith, right? Or this belief of, I don't want to add chemicals to my body. So like the crunchy movement. I hear you, right? I am
Yeah.
like 50% crunchy, I'd like to think. And there are times when medication is somewhat worth it. What we know too, I want to point this out. Say SSRIs. Those are your antidepressant medications. or
selective
Xanax.
serotonin reuptake inhibitors.
Yep. Those get grouped with things like Xanax because Xanax is used for anxiety. They're not the same class. I want to be really clear.
Yeah.
For SSRIs, there are numerous studies that have come out, including in pregnancy. And pregnancy is a time in which they really get a bad rap of, I can't take meds because I'm pregnant.
Yeah.
Wrong. 1. 2, we know that the stress of a mama or depression of a mama who's carrying baby, that is actually more harmful to the fetus and more harmful to the development of baby even out of the womb than the medication themselves.
Mm-hmm.
So in other words, the untreated mental health condition is worse for the baby than taking, say, Zoloft. I point that out because there's so much fear around how the medication is going to hurt mom or baby when actually the mental health condition has more side effects than the treatment itself.
And there's a big risk for mental health issues during pregnancy.
Oh, yeah.
Because of, one being the hormonal fluctuations throughout and even after the postpartum, which you specialize in.
Yeah. And I think about even cortisol production. If you have cortisol production while you're carrying baby,
Yeah.
that transfers to your baby. They are more likely to have higher cortisol production in their own body, which impacts them even in terms of babies and adults and how much they produce cortisol. It is more likely to cause developmental delays.
Yeah.
It can cause physical abnormalities. So we have to talk about that piece too of, okay, medication might have side effects of sexual functioning or weight gain. But what are the side effects if I don't treat it? Right? Same with diabetes. Side effects can happen with those medications. Newsflash.
Yeah.
But if we don't treat it, what are the risks there?
Yeah. And these are conversations we should be having with providers. These are the questions we should be asking.
Yes.
But we first have to get past that barrier of, I'm not taking meds. Like, I'm not doing it. No,
Really
it's
explore
weak.
the why. If you're that adamant, why? Where does that
Yeah.
come from? Have you actually consumed the research, the knowledge on it? Or is this just something that you were told and thus it's imprinted into your brain space?
Well, and I think about male culture, especially in the United States.
Yes.
There's a lot of, well, that's weak. You need to be the strong person for your family.
Suck it up.
Suck it up. So that's a huge cultural narrative that's kind of passed down
Mhm.
and still very present. And so I would say that's probably the number one barrier I come across with male clients
I can see it.
is, well, I'm weak. Something's wrong with me.
Mhm.
There's so much variability in humans. It's, well, what is norm or not? There's people who go and are experiencing those things and you might think they're functioning, but inside they're not. But you're like, they don't need medication, but you also don't know what's going on for them.
When we talk about even things like suicide, we think that when we talk about medication, right? Okay, people are fine, so they don't need medication. The time someone's actually most likely to commit suicide is on their high, not their low. So if someone's really struggling, they typically don't have the energy for it. they don't have the wherewithal for it. It's when they come back to that high. And that is the moment in which we say, see, they don't need treatment.
Yeah.
They don't need medication. It's the exact moment they do, because so much is happening within the body that we're not even acknowledging or noticing. It's really interesting when you actually dig into the psychology behind depression, anxiety, suicidality, all the things, what it actually presents, what it looks like, what's going on in the brain that you cannot will yourself out of.
Yeah.
We think if I just say, I'm not going to be anxious today, I'm not going to be depressed today, it'll go away.
I mean, some of it's chemical.
That's what I mean.
Yeah.
It's not just going to go away. I wish it would.
Yeah.
But it won't.
And us talking about medication doesn't mean I'm not open to the alternatives.
Absolutely.
There's a lot of people who don't do like the medication because they're stigma against big pharma. Like they're only making medications to make money. I mean, sure, if you want to do something else, what is that? Just make sure you're doing research on it and working with somebody who knows what they're talking about. That is probably those are probably the most unregulated forms of, I guess, medication, if you will, that I experience with clients that are like, oh, I talked to so-and-so and they recommended X. So I went down to, Sprouts and picked this up, and I'm all for that. But at least be an advocate for yourself and go do the research. And I also advocate for that same mentality when you're working with medication that you have to get prescribed from a psychiatrist.
Truth.
Like it's very, very important to do your research. The other thing too is I see, I don't want to do medication, and then people are vaping. And I'll tell you why vaping is an issue in some regard, because they're like, well, it's not, it's harmless because of X, Y, Z. The thing is that the metals of which these things are made for are unregulated. And you've seen a lot of, especially the inhaling of those metals are causing issues. So it's okay, here's medication, here's the side effects, but then you're sitting here with something that's not regulated and you have no problem putting that in your lungs. Just think about how what we're doing might contradict these stigmas we have as one way to break that barrier of, oh, well, I'm kind of already doing this. Can I apply this mentality to exploring medication?
Marijuana is another big one.
Yeah.
I use marijuana to treat anxiety. Okay, here's the thing. Marijuana is in two classes of medication, a depressant and a hallucinogen. It is going to make your depression and anxiety worse over time. So you might feel that hit in the moment, same with alcohol. But the reality is it's actually hurting your neurochemistry for the long haul, even if it doesn't feel like it in the moment. So some of these, I get it, right? Especially marijuana, I hear like, it's grown, it comes from the earth, so it's fine. Look at the long-term side effects of that. Look at, is it actually improving your quality of life for the long haul, or is it just in those few moments that you're high that it's actually helping? Yeah,
and again, do research, right? I mean, some people have different reactions.
Absolutely.
And I always appreciate when clients are very aware. I'm like, I always assess, have you smoked marijuana, or you can currently? Yeah. And they're like, I did, but it does this for me and I don't like that. I love that awareness. If you want to try things, great. Make sure you're doing your research. Make sure you're looking at somebody who might know what they're doing that can guide you through the process, and be very aware of what's happening for yourself.
And they're not all created equal. So the same is true for psychotropics or mental health medications. So SSRIs, that's one I mentioned earlier about depression and anxiety.
Yeah.
There are so many different types. And just because they're in the same class of medication, they do not interact the same in each body. So some people might be able to take one and not another, and then vice versa. Even though they're all within the same group, not every body metabolizes them the same way. So if you have a bad side effect with one, if your sex drive tanks out, if you gain weight, if you don't like how you feel on it, don't give up on that class of medication. Try another one.
Yeah.
Right? Because there's so many options. And you don't have to feel numb or feel like shit or not want to have sex with your partner or feel more irritable. That's not the goal.
Yeah.
The goal is to feel like yourself. Cannot say that enough.
Well, somehow we're all experts now because of Google.
Dr. Google.
But there's a lot of things, there's nuances that they don't talk about that psychiatrists are very much experts in. And that's how do certain medications impact what mental health you are experiencing now? So for example, you're going to treat, I don't know, depression with somebody who has also post-traumatic stress disorder. They might need to have a medication that works on the dopamine system and not necessarily serotonin, right? I mean, but that's not for us to know. It's not for Google to be like, yes, this is very much not something that you need to do.
Or your primary care. Primary cares know a little about a lot of things, not a lot about one thing.
Yeah, exactly. Very much. But just get curious.
100%.
Check your assumptions. And, the research is very clear, especially with anxiety and depression, that we've talked about this in other episodes, is treatment is 80% more effective with therapy and medication together than either of those alone.
Ooh, I didn't know that. I believe it, but I didn't know that.
So, and part of it has to do with the fact that when we're on medication, we get to a point, like I talked about earlier, where we're at a good baseline that we can actually now absorb some of the skills and things that we're learning through therapy or processing the things, right? Because some of the things that we're processing causes too much distress. If we can't manage that distress behaviorally and we're not on medications, it's very hard to kind of do any of that work in there.
100%.
So being able to have that distress tolerance can be very, very, very important for success in therapy.
Especially if we're looking at something like trauma.
Yeah.
Having medication that can help soothe your nervous system so that you can actually talk about it without going into full fight or flight or dissociative state, super critical. But I liken it to a cast for a broken leg. Okay, if I break my leg, do I technically need a cast? No. It would heal on its own. Might heal a little crooked, might heal a little funky. It's not going to be as stable, but I don't need it. But everybody chooses the cast. Why? Because it gives us a better result. It is temporary, but it helps us feel strong while we're healing, gives us capacity to heal. Meds are no different, right? Could I do it without the meds? Probably. Is it going to be as effective, or am I going to take longer if I don't have meds? Maybe, right? And it doesn't have to be forever. I don't have a cast on my broken leg forever. It's temporary, just long enough for the healing to occur. And then I do rehab afterwards to build it up. The same is true for mental health medications. You may not need them forever. And if you come off of them, you're still going to continue your coping tools. You're still going to maybe continue therapy for a bit. You're still going to do the things that help get you to a better place, even aside from the medication, if that makes sense.
Yeah. No, I love that analogy. Because again, we have priority for physical health.
All the time.
But mental health is that's more periphery. I'll do it. It's like probably one of the first things given up when things get tough.
100%.
Like the dentist.
What if you have diabetes? And I was like, you're just weak.
Yeah.
You wouldn't say that.
Yeah.
You would never say that to someone. Or you have arthritis or you have cancer. Just suck it up and fix it yourself. You're weak. No, you do the treatment.
Yeah.
Mental health is a physical health condition. Of course, it's mental, but something is occurring physically within the body for the majority of people who are struggling with it. Don't forget that part. You can't force your neurochemistry to change.
And if someone just doesn't believe in medication, fine. We're not here to push that.
Truth.
I just don't want people's assumptions to keep them from being an advocate for themselves. And the best way to challenge assumptions is get curious and go learn. Don't allow your assumptions be the truth. There's too much other stuff out there that we're not experts in. So if you're not trained in it, then check your assumptions, question them, go learn. And beyond Google, talk to a professional. And granted, look, not every medical provider is cut from the same. So find one.
No psychiatrists are created equal.
Yeah. So there's nothing wrong with shopping around.
Yep.
Because there are some psychiatrists who push it. And there's some who love to explore it with you. And they're very much an advocate for, ooh, yeah, let's not do that. Let's change this. I don't like what that's doing for you based on what you're saying. And they're very much in tune with you. Just find that. Find the one that you're comfortable with, who's willing to explore and maybe even inform some of your assumptions.
I'm thinking about even in Northern Colorado, there's a psychiatric nurse practitioner who I adore. And she doesn't just talk about the psychotropics or mental health meds. She also talks about what's your vitamin intake? What are you doing for movement?
Yep.
And different kinds of supplements you could add. So she doesn't just talk about that. She talks about a whole-bodied approach to mental health too. And so if that's more your jam, find that person in your community. But there are so many different variations, just like your primary care, just like a therapist. Fit can be everything in treatment. If you don't have a good fit, switch it up.
I don't know why we're talking. I'm just thinking about the whole bleach during COVID. And I was like, that's such a great example of, remember there was like something that came out that was like, just drink bleach, that'll help kill COVID.
Oh yeah, I know where that came from. But
so
neither here nor there. Yeah.
But my point being is that that's a great example of everyone's an advocate of, physical health. But I bet you the majority of people question that. And like, wait a second. So if you're willing to question that truth, question the truth about medication for mental health too.
Did not know where you were going with that.
Yeah.
All right. Got you. With you. Don't drink bleach, folks. Do not do it. Or eat Tide Pods for that matter.
Or bath salts.
But it's true, right? These trends spread like wildfire. And one of the trends was, screw Big Pharma. I'm not going to get treatment. I hear you. I don't love everything Big Pharma does.
Yeah.
I don't support some of their missions. And what Big Pharma provides are things that can change a life, even save a life.
Yeah.
If you're teetering, if you have questions, do the research. Talk to someone, not Dr.
Mhm.
Google, someone who's qualified, as you said, because it could change your life. Could make it so you're a more attuned parent, a patient parent. You might not be so irritable. You might want to be closer to your partner. You might want to interact in the world again and get out of your bed. You might seek medication for PTSD so the flashbacks can stop, the nightmares can stop. It truly can change your mental health. And by changing your mental health, it changes relationships, life satisfaction, life quality, your productivity at work, you name it.
Yeah.
How our mental health is directly impacts every other part of our life.
And this should always be an ongoing conversation with yourself and a provider. If this is something that you need to stay on or want to stay on, again, it doesn't have to be permanent, but I think about diagnoses like bipolar.
Yep.
That has saved so many of those who are diagnosed with bipolar with their quality of life, the stability that they get from some of these medications. But granted, I don't blame the mistrust. I mean, we don't have a good history and the over prescribing because of how our system works with the medical salesmen that come to doctors' offices and promote to
They do
have that provider prescribe. So I get it. But this is where, as an individual, we have to do our research, check other providers, get different opinions.
I want to just real quick too touch on kids. Okay, Greg and I are not experts in psychiatry, but I want to touch on this piece. As a mama of a kiddo who's neurodivergent and has been offered a medication route to treat that, do your research for your kids.
Yes.
Oftentimes before puberty may not be the right fit. And for some kids, even at 7, 8 years old, medication can make it so they can be in school still. Medication can make it so that they can function and have a social relationship.
Mm-hmm.
Find a psychiatrist that is specifically pediatric. If I can say anything, pediatric psychiatry versus adult psychiatry are two entirely different wheelhouses. So find the right pediatric psychiatrist and do your own research in addition to that psychiatrist of how it impacts development, puberty, brain development, all the pieces. Like, I cannot emphasize that enough.
Yeah. And be skeptical.
Yeah.
I advocate you be skeptical. Don't just take it for what a provider says either, but don't allow your assumptions to be where the buck stops.
Truth.
Because then you can't really be a true advocate for yourself.
Or your peanut, right?
Yeah.
And if your kiddo's really struggling and you're just telling them like, hey, I just need you to focus at school. Say they have ADHD. They may not be able to. That may not be something they can do without medication. That's why I want to name it is sometimes with kids, it is also necessary, right? If I tell you on your most distracted day, I just need you to focus, you're not gonna be able to do it. So don't be afraid to also have these conversations with your kids, about your kids. And if you choose not to, full respect.
Yeah.
But if they need it, also full respect.
Yeah. And again, I just wanted, before we wrap up, is make your choice informed.
Absolutely.
That's all we're saying is
Deep dive it.
There's nothing wrong with taking medication to manage mental health symptoms. And be skeptical and do your research.
You don't have to have your family's permission to take medication for your body, right? We think like my parents will judge me and I'm 35 years old, but I'm worried about what my parents are going to say or what my partner's going to say. You're an autonomous adult. You get to choose how you support and treat your own body. Treat this just like physical health, right? If it's a physical health condition that you would look for alternatives for first, cool, rock it. If it's something that needs medical support, also do that.
Yeah.
Well, this has been another great episode on medications for mental health. As always, if anyone has any questions, feedback, topic suggestions, we are all ears. Email us at relationshipsinsideout@gmail.com. Thanks so much.